Today I want to talk about using Winback TECAR therapy for early onset Duputrens. So we have it's starting in through here. The Duputrens are starting in through here. There's some tightness along this fascial sheath as well. The pain and discomforts in through here. We've been treating this and it's been working out very well. It's a very superficial tissue, but when again, we stretch it a little bit. I don't know if you can see it pops up right in through here. So the tenosynovitis, the Duputrens, even trigger fingers work really well. But since this is so superficial, I find going right after it with the mix works really well because we can get a nice heating effect and we can get the RET to loosen the tissues. So we'll work this first, and then, like so many other really adhesive conditions, we'll stack it right afterwards with some radial pulse wave. And this doesn't get much. It only gets about 400 hits. We go slow. We go about 10 hertz at about 60 joules, or about 1.2 bar, something like that, very slow. Now, as this warms up, we get nice softening of the tissue. Then I drop it down and we just kind of hold it there. So I get away from the heating effect and I could really let it sink into that tendon. So this works really well for the Duputrens, so check it out.